So I'm here with the wonderful Dr. Brooke, and today we're going to be talking about some of the symptoms and discussing ovarian cancer so that we can inform you guys a little bit more about what it is and how you can notice the warning signs. So I guess the first thing I want to know is, what are the symptoms or what can we look out for when it comes to ovarian cancer?
Okay, so I think the first thing to think about is, what are our ovaries? Our ovaries are inside our tummy, and they are a really important organ because they produce hormones that give us our menstrual cycles, and they also contain the eggs that are released on a monthly basis, which allow us to kind of be fertile, important for the reproductive system. Now, ovarian cancer develops when there are cells in the ovaries that multiply too much and they become malignant. And the difficult thing with ovarian cancer is the symptoms are often really subtle. And so, you know, with other types of cancer, when you've got cervical cancer, you might get abnormal bleeding or, you know, bleeding after sex, things like that. There's not such obvious symptoms with ovarian cancer, which is what makes it really difficult. So the main things that we want people to look out for are feeling very bloated, unusually bloated. Now, again, that's a common symptom as women all get, but kind of abnormally bloated, feeling really full after you have a meal, again, unusually so for what you've eaten, let's say. Feeling that you need to wee more often than usual, and also kind of any abnormal abdominal pains.
Yeah, so I guess with that, it's recognising what is your normal, and then knowing from that, I guess, if something changes. So is it more that we should be more aware of, you know, our bowel movements and our general kind of like how often we go to the toilet and things like that, so that if we do notice a difference, we can be far more aware of that?
Definitely. I think all of us, we all need to kind of take responsibility for our bodies these days, kind of get to know what's normal, what's not, what does your cycle look like, tracking your cycle, when you expect to be ovulating, so that if you get, you know, unusual pains, for example, you can notice them. Knowing what your normal toilet patterns are is really useful. You know, do we all notice how often we wee in a day? Would you know what's normal for you? Would you know how often, you know, maybe you open your bowels, things like that? So when you're feeling well, recognizing what's normal for you will allow you to pick it up when things are not normal.
You talked about the menstrual cycle and tracking your cycle. Interestingly, you didn't mention changes in the cycle as being one of the symptoms of ovarian cancer, and I was interested in that.
Yeah, I mean, it's not one of our key pickups, but sometimes people do come to the doctor, and one of the things they've noticed is that their periods may have disappeared completely. They might be worrying that actually they're approaching the menopause, feeling more bloated than normal, and maybe have some of the other symptoms. But yes, abnormalities in your menstrual cycles, being extremely irregular, your periods, can be a sign, but the thing is, it's not one of the key features, and also again it's quite common, and there's a number of other reasons that might cause that, like abnormal cysts that aren't cancer. But I think if you have noticed new abnormalities in your cycle, that's a good enough reason anyway to see the doctor.
You mentioned the menopause. I think for most people, ovarian cancer is sometimes seen as an older women's disease, but is it something that can affect younger women too?
Yes, so the majority of cases are in women that have gone through the menopause or perimenopausal. So typically we kind of say it's women in their 50s that are usually diagnosed. But yes, there is a hereditary component as well, so where your genetics or your family history may make it more likely for you to develop ovarian cancer. And if you have kind of a family history that might make you more likely to get it, those women tend to get it earlier, kind of at a younger age. So it's not something we can just say, oh, you know, I haven't gone through my menopause yet, I can't get ovarian cancer. You can. It's a really good idea to talk to your family, find out, you know, if there is any certain types of cancers in your family, and if you need to have any kind of genetic testing when it comes to that.
When it comes to cancer, it's obviously one of those things that it's still debatable to what extent it's preventable, and I think it's a really big topic. But I guess, is there any advice you can give in terms of lifestyle factors that we can implement that maybe reduce the risk of ovarian cancer?
Regular exercise, eating a healthy and balanced diet, and not avoiding smoking. They're the kind of big ones.
So you mentioned all of those, but I also wondered about whether sexual health had an impact on perhaps your likeliness of getting ovarian cancer.
So it's a really good question, because HPV is a virus, the sexually transmitted virus, and that is implicated in cervical cancer. So that, you know, in those situations, the infection can result in a type of cancer, but there's no viral. There isn't a virus that makes it more likely that you're going to get ovarian cancer. So no, it's nothing to do with your sexual history or your previous partners.
One thing that I was really surprised by was that I kind of assumed that by going for a smear test, it was kind of a big tick box of like, I'm free from everything, I'm all good, and like, there's been so much noise around getting your smear test, which is wonderful, but can you explain why it doesn't cover checks for ovarian cancer?
Yeah, it's a really common misconception, and it's great that we're increasing the awareness of smear tests and cervical cancer, but unfortunately, that doesn't check for ovarian cancer. So your cervix is the neck of your womb, and that's the bit that your smear test is checking. It's checking the cells of the neck of your womb. However, to access your ovaries, you can't access via the cervix. So there isn't at the moment a screening test, unfortunately, for ovarian cancer. As we've kind of spoken about, being really aware of the symptoms and and going to get help if you notice any new symptoms developing is the best thing you can do, and also being aware of your family history. So if you kind of have any members of your family that have been affected, particularly by ovarian cancer or breast cancer, go onto the Ovarian Cancer Action website, and they've got a really useful toolkit that can help you to work out your own risk if you've got any kind of family history, risk of developing ovarian cancer.
That's so interesting. Thank you so much, Brooke. I definitely learned a lot there, and thank you so much for your time.
Thanks for having me.
Is that okay? That doesn't cover checks for ovarian cancer.
Yeah, it's a really common misconception, and it's great that we're increasing the awareness of smear tests and cervical cancer, but unfortunately, that doesn't check for ovarian cancer. So your cervix is the neck of your womb, and that's the bit that your smear test is checking. It's checking the cells of the neck of your womb. However, to access your ovaries, you can't access via the cervix. So there isn't at the moment a screening test, unfortunately, for ovarian cancer. As we've kind of spoken about, being really aware of the symptoms and and going to get help if you notice any new symptoms developing is the best thing you can do, and also being aware of your family history. So if you kind of have any members of your family that have been affected, particularly by ovarian cancer or breast cancer, go onto the Ovarian Cancer Action website, and they've got a really useful toolkit that can help you to work out your own risk if you've got any kind of family history, risk of developing ovarian cancer.
That's so interesting. Thank you so much, Brooke. I definitely learned a lot there, and thank you so much for your time.
Thanks for having me.